Good afternoon, everyone. If I could have everyone's attention in the room and call ourselves to order for the next session. This is how we do this in American Sign Language culture. Hello, everyone. Welcome to this session as it pertains to innovation and inclusive education, especially in low and middle income countries. My name is Joshua Josa, and I work with the United States Agency for International Development, USAID, headquartered in Washington, D.C. I am a disability inclusive education advisor. Basically, that means that I advise practices on inclusive education to 60 country missions that participate in our educational programs. The purpose of today's session is to look at different successful, innovative ways to approach the issue of inclusive education around the world. As an example, children with disabilities in rural areas may need special teacher training programs in order to get the best type of education. To the technical staff, I had several slides that I had sent just to kick off the session. I don't know if you have those available. For the audience, I did have some slides that I thought that I would be speaking to before I introduce the other presenters, but I don't see those on the screen. So to the technical staff, if we could get those up, if you have them, that would be great. Before I turn it over to the presenters to talk about their own educational approach, I do want to discuss the work of USAID as it pertains to inclusive education. USAID takes the education of children with disabilities very seriously. In the world in which we live, many countries do not yet have opportunities for all children, and we want to make sure that marginalized children, especially children with disabilities, are included in all contexts. We know that there are different challenges that lie ahead for programs to be successful. Sometimes we might want to start by looking at the financial system of education and how money can be divided among programs, whereas other times we may want to look at teacher training programs and evaluate their effectiveness, whether the university system has the right resources in order to effectively train teachers for education in, for example, sign language or other methodologies. Do they have occupational therapy resources in their country? There are many barriers that lie ahead to making sure that we can transform education to effectively reach these students. The CRPD, Article 24, and General Comment Number 4 have set very clear goals as to the vision of inclusive education and the ways in which students should attend schools near their homes, near their families. I think we need to have a better understanding of what inclusive education means for children with disabilities, especially the nuances, and that particularly pertains to deaf and hard of hearing students who need to be educated in settings that include sign language, which may not always be in their closest schools. One example of how USAID has helped this approach is by drawing from an organization named CAST to design universal design principles for learning and reading. We have a toolkit that was issued earlier on that has really transformed the way that many countries are looking at designing better systems to support literacy among children with disabilities. Our website is www.edu-links.org. Apologies, that would normally be on the slide, but we don't have that at the moment. Hopefully you've got that. USAID has also invested $3 to $4 million in Cambodia, Nepal, and Malawi to look at their ecosystems and really develop better data that informs the way in which we transform programs in these countries and their peer countries. We also have a multi-country study, the first of its kind, that is looking at those 3 countries and the ways in which they have made progress to better serve children with disabilities. And we do hope that those findings will be published soon so that you can use them in your own contexts. The third way that USAID has invested in inclusive education is through the All Children Reading program that was launched in partnership with World Vision and the Australian government. This is now the 3rd round of financing for that prize. And the big announcement to be made is that an early grade reading assessment for children and whether they have turned into successful readers had finally made some breakthroughs with deaf and blind and visually impaired students. So looking at the adaptation that's possible through these types of models will hopefully make some strides in improving inclusive education the world over. So we're focusing on 3 tracks with this next and final round of funding. Disability, access to books for underserved populations, and other grant program opportunities. So keep your eye out if you're interested in teaming with USAID on some of our grant initiatives. And please also feel free to come up to me in person after this presentation. So not having my slides, I will forego formal introductions of all of the speakers and ask them to introduce themselves, starting all the way to my right of the stage and moving to the other side. So Helle, please introduce yourself and your organization, and we'll go down the row with just introductions.
Can you hear me?
She has a separate mic. I don't know if it's working. Or should we try this one?
No.
Sorry.
Please, technic stuff, can you mute me?
No, it's working.
Hello?
Yeah, it's working.
It's working? Okay, sorry. So I'm Helle Deertz. I'm working together with my colleague sitting next to me at the GIZ in Bonn. We are working for the ministry, Federal Ministry of German Development Cooperation, and I'm working there since nearly 5 years now, first in the inclusive education sector, in the field of a study we did in Malawi and in Guatemala, and then I handed over to the global project inclusion of persons with disabilities.
And if I could just interrupt, I'm sorry to interrupt, but just keep it to your name and organization to begin with, and then we will begin with all of the presentations, if that's all right.
Okay, so that's all.
Good morning,
Thank you very much.
I hope you can hear me all. My name is Helle. I'm working for the GIZ sector program education, also at headquarters in Bonn. Thank you.
Afternoon, everyone. My name is Deborah Tigere. I'm the country director for Christoffel-Blindenmission in Zimbabwe.
Good afternoon, everyone. My name is Cailin Campbell, and I'm the development coordinator at ADISA.
Hello, I am Juma from the State University of Zanzibar, Tanzania.
Hello, I am Maryam Ismail, the Dean of the School of Education from the State University of Zanzibar.
Good afternoon, everybody. I'm Thomas Knapp from A Chance for Children, Uganda.
Thank you very much for those quick introductions. As Charlotte mentioned yesterday during her opening comments, the developing countries are places of many innovations, many models that we can learn from and use the world over. there are also many opportunities to leapfrog places that have been working in other places for a long time but have made mistakes. I think these are wonderful opportunities for us to learn about the innovations that are going on in these countries. Each presenter will have 9 minutes. I know that 9 minutes is a short amount of time, but it is a precious amount of time, and I want to leave it to each of these presentations. At the end, we should have about 10 minutes left over, and I hope that members of the audience will formulate questions during the presentations that they can ask at the end. So I'll leave it to Deborah for her 9 minutes.
Thank you, Joshua. It is a privilege for me to be presenting for the first time all the way from Zimbabwe. As I mentioned earlier, I work for Christoffel-Blindenmission, CBM, as a country director. I'm going to be presenting on an innovative inclusive education project that has primarily been focusing on converting special schools into inclusive education centers. So a little bit about CBM. CBM is an international disability inclusive development organization that focuses on improving the quality of life of people with disabilities in the poorest countries. And Zimbabwe is a very low-income country. CBM has been supporting programs in Zimbabwe for the past 35 years in the area of education, community-based rehabilitation, livelihoods, advocacy, emergency response, eye health, among other projects. Now, to talk about the project that I'm going to be presenting today, in partnership with our local partner, Tigere Association, we have been collaborating through the Ministry of Primary and Secondary Education to implement a 3-year program to support 3 inclusive education centers in Zimbabwe. And this is Gweru Nanan Center, Kadoma School, Waterfall Center. The 3 schools host a total of over 440 children with disabilities. And this project has been focusing on strengthening access to quality early childhood development and in promoting inclusive education through pre-vocational skills development, disability training and awareness, capacity building of parents and teachers, provision of teaching and learning material, and assistive devices. Now, in collaboration with several stakeholders at local, national, and other international actors, we have been able to engage and provide a platform to discuss inclusive education. And I really appreciate the synergy in multi-stakeholder networking, which has also enhanced the linkages to our vocational and life skills training. Our approach to teaching children with and without disabilities makes this project very unique. In other words, this project has been promoting reverse integration into mainstream schools, and within the same centers, we have children with and without disabilities, which makes it a best practice model. And in Zimbabwe, again, I want to emphasize the multi-actor approach that we have used to engage the relevant stakeholders with the leadership of the Zimbabwean Ministry of Primary and Secondary Education to ensure that we review the education policy framework. And as I speak, a lot has been going on in terms of developing the inclusive education strategy. So CBM, jointly with other stakeholders, has been very active in advocating and ensuring that this process is actually inclusive and consultative. And of course, talking about success, the 3 centers I'm talking about have been well positioned to leave no one behind. These 3 centers, the Tigere centers, have been accommodating children from across the country. And of course, as I mentioned earlier, the aspect of reverse integration and inclusion into mainstream schools makes them very unique and a good model. Now, we need to support the strengths of individuals who come up. And as you can see in the picture, I have Anesu there. Anesu is a student, 17 years old, with low vision and albinism. And ANESU developed an animal scaring device and won a nationwide competition in Zimbabwe. Talking about financing, which is something that is very important, this project was supported worth €500,000 and financed by a consortium of various small foundations. A consortium means that the number of foundations, several foundations are brought together and their resources are joined to provide a holistic funding towards such projects. Now, joint funding is very important because you begin to realize the efficiency and effectiveness of implementing such projects. And as CBM, this is a very instrumental administrative tool that we use to mobilize resources and fund our projects efficiently. Talking about sustainability, I'm coming from a low-income country where sustainability is very difficult to talk about. So despite the challenging economic environment that we have in Zimbabwe, sustainability still remains important in our project design, implementation, and policy development. And through this project, we have tried to achieve sustainability through training, awareness raising for students, parents, and communities. But also, these centers I'm talking about are implementing a number of livelihoods projects in order to generate some income, but not just for the income. These projects are also bringing food on the tables for these students, in addition to that, complementing the life skills and learning in agriculture. Our next steps to be more inclusive in education. Advocacy remains a priority in our work to ensure that the voice, choice, autonomy of girls and boys with disabilities is included in policy and program development. The involvement of disabled people's organizations remains critical in our work as these act as role models, but also to promote our advocacy work. And of course, it's important for the various schools to be participating in policy and program development. Thank you for listening.
Thank you very much, Deborah, for your presentation. I want to very much acknowledge that your work has been looking at different levels of the system of education in order to make some inroads. I think it's important that we don't limit ourselves to only one school or only at the top level, but that we look across the board. Our next presentation is going to be from the person immediately to my right, Cailin.
Good afternoon. My name is Cailin Campbell, and I'm honored to be here today along with Francisco Sojuel, the Executive Director of ADISA. ADISA is an organization that I'm continually inspired to be a part of, an organization that began nearly 22 years ago when Francisco and his wife Argentina's third child, Nila Lisa, was born with hydrocephalus, and they were made aware of the lack of services and opportunities available for people with disabilities in Santiago de Titlan, Guatemala. What began as a small committee of parents has grown to become a leading organization in Latin America. Today, using a community-based rehabilitation strategy, ADISA offers healthcare, education, and economic empowerment programs to more than 500 people with disabilities each year. So educational opportunities are limited in the indigenous Sotujil-speaking community of Santiago de Titlan, and for students with disabilities, these opportunities are even less accessible. While a lot has improved since ADISA began over 2 decades ago, there is still much progress to be made. People with disabilities are no longer entirely excluded from receiving an education. There is now a special education school. Many children with disabilities have been integrated into the public school system. And last year, the state implemented an inclusive education resource center. But these efforts alone, can you hear me? See? Okay. But these efforts alone have proven to be insufficient. Teachers lack the tools to best serve children with disabilities, and the resource center is under-resourced and understaffed, having only one teacher supporting all 40 schools in Santiago Atitlan. Therefore, until the state assumes its responsibility, ADISA's inclusive education program seeks to fill that gap. Our approach is comprehensive and community-based, and it includes the entire community, students with disabilities, their teachers, their classmates, and their parents, offering complementary healthcare and economic empowerment programs. Our inclusive education program trains public school teachers in inclusive methodologies, first participating in a year-long inclusive education certificate program, and then receiving follow-up trainings on topics of their request. The program also provides academic support to students in their homes, both one-on-one and in groups, and offers parent workshops to improve parenting strategies, promote acceptance of disability, improve mental health, and start to create a pathway towards empowerment. I think it's important to mention that our work with parents and families of children with disabilities is especially critical. While a lot of progress has been made, there is still stigma surrounding disability in our community. Mothers are often blamed for their child's disability, and families often have a hard time accepting their child's disability. Therefore, in order to ensure an environment that fosters inclusion for the child, our approach must include the entire community. That being said, our program also organizes extracurricular activities for children with and without disabilities to promote socialization and inclusion. We also provide early intervention therapy for children under 6 years old, helping develop those early skills so they are ready to start school. This year, the program works in collaboration with the state-run program, Acompáñame a Crecer. And we run sign language classes for children, adults, and families. In 2019, 166 students received specialized one-on-one support at home, and 155 teachers participated in trainings on inclusive reading and writing methodologies, language strengthening strategies, and early intervention therapy. This year, in 2020, per request, teacher training is focused on teaching mathematics in a more fun and inclusive way. In sum, ADISA's inclusive education program has educated children that otherwise would have never been allowed to attend school. Now, children with disabilities in Santiago Atitlan are going to class, participating in school activities, and some are even going on to attend university. For example, Salvador, pictured here, at age 5 began displaying symptoms of juvenile rheumatoid arthritis. His parents did not have the resources to take him to the hospital, so he spent 3 years confined to his bed. Unable to move his arms and legs, he was sure that he would never return to school. Luckily, at age 8, ADISA stepped in and Salvador began to receive treatment. At 23, ADISA also ensured that Salvador received an education. And at 23, he graduated from secondary school where he had studied accounting. He now works in accounting at ADISA and has his own accounting practice that serves several clients. He is currently attending university and is on track to graduate with a degree in business administration this year. Stories like Salvador's have been made possible thanks to our generous donors, especially CBM, the Strachan Foundation, and the Archdiocese of Osaka. However, we recognize that donors come and go, and we believe our approach to be sustainable because we invest in the community itself, its students, and its teachers. By training teachers in inclusive methodologies, the tools and skills stay in the public schools to benefit present and future students. Unfortunately, while there are wonderful community educators in our community, many are still resistant to change. And the state of Guatemala has yet to fulfill its responsibility to children with disabilities. There are laws in place, but requirements are often unmet. At ADISA, we want to create a model school in inclusive education because we believe in a just and inclusive society where persons with disabilities are recognized as equal and contributing members, a society where people with disabilities have the same educational opportunities as their peers, and a society where teachers are equipped with the tools to best prepare their students for the future. And we are committed to continue fighting until inclusion is a reality. Thank you.
Thank you for that. I really loved how your presentation touched on the different ways in which the system, similar to Deborah's presentation, is really important. And it's important to look at the complicated levels that are there in place. Your services that you have touched on, the wraparound services that make sure that children who are experiencing some challenges, maybe because the government is incapable or refuses to support them, are still able to succeed, that they have ways that you are supporting them in building a country that is inclusive and supportive of their educational needs. So bravo to that. Next up, we have our colleagues here to my right. Are you from CBM as well? Oh, excuse me. My colleagues to my left. Please, the floor is yours.
Good afternoon, everyone. Now let us take you to Zanzibar, and we are going to talk about improving teachers' pedagogical skills. And we are from the State University of Zanzibar, and this is a public university which was established in 2001, and it is in Tanzania, or United Republic of Tanzania. It's a very tiny dot place. So if you want more information about the State University of Zanzibar, you can click www.suza.ac.tz. But actually, we have a School of Education which is training pre-service teachers and in-service teachers. The population of Tanzania is estimated to be 59.7 million. And in Zanzibar alone, it's in this 2020, it is 1.7 million. My colleague will continue with the second slide.
Hello, I'm Juma from the State University of Zanzibar. Well, Zanzibar, like many other countries, began to reform its inclusive education system after the Salamanca Statement and Framework for Action.
Go ahead.
Okay. Yeah, so Zanzibar began to transform its education system after the Salamanca Statement and Framework for Action. So the Ministry of Education and Vocational Training wanted all schools to accept all children, including those with disabilities. Because before that, children with disabilities most of them were not sent to school. And Zanzibar has never had special schools. We only have special classes. Out of more than 1,000 schools, we have about 9 schools with special classes. So majority of children with disabilities were just hidden at home. They were not sent in school. So when we began to introduce inclusive education in 2006, the main problem was how to support teachers to teach inclusively so that they can support all children to learn and reach their full potential. Now, the first approach that was used was a cascading model whereby a few teachers, 2 to 3 teachers, were taken from each school, and then they were trained, and then they were supposed to go back to their schools and teach other teachers in their schools how to teach inclusively. There was a challenge in this approach because there was a lack of post-training follow-up, and also the burden of teaching children with special educational needs, including those with disabilities, was left to only those teachers who had attended training. So other teachers found that they were not responsible to teach children with special educational needs. Now the solution was to change the teaching approach. So from 2016, we worked with Enabling Education Network based in the UK to establish a teacher training program. So this teacher training program changed the approach from cascading model into whole school or immersion model, whereby all teachers in the selected schools were trained. So we did not pick a few teachers to train and then expect them to deliver the training to their fellow teachers. So we selected 8 pilot schools, and all teachers in these 8 pilot schools were trained. And trainers were selected from teacher training institutions like State University of Zanzibar, also from the Ministry of Education and other institutions. Now, these teachers in the 8 pilot schools were trained in 7 modules. So we trained them on introduction to inclusive education, school inclusion teams. So we taught them how to create school inclusion teams. And the other module was on identifying out-of-school children, because there are still some children who are out of school. So it was important for teachers to make sure that all children are enrolled in school, including those with disabilities. Another module was on screening and identification of learning needs. The 5th module is on creating individual education plans. The 6th one is on exploring the role of a school inclusive education coordinator. And the 7th module is on promoting active learning in the classroom. Now, this project began in 2006, and as I said, we selected 8 pilot schools, and the project benefited 170 teachers in these 8 pilot schools. Now, another success was that in these 8 schools, there are school inclusion teams. These are teams made up of teachers, community members, like influential leaders, like religious leaders, like doctors, engineers, any people that can come together to work with the teachers in these schools to make inclusion a success. So these school inclusion teams have worked, and they have managed to do many things, including bringing back children who had dropped out of school. And another success is that the number of children with disabilities in these 8 pilot schools increased. For example, before this project, in 2015, in these 8 schools, there were 102 children with disabilities, but by 2018, there were 233 children with disabilities who are enrolled. Also, the project managed to return children who had dropped out of school, including those with disabilities. So there were 187. Yeah, but another success from this project is that it improved the quality of in-service teacher training. As I said, the first model was cascading model, which benefited only a few teachers. so it was not effective. But the new approach that we took, the whole school approach, seemed to be effective. And also it established a strong working model, and other schools could also come and learn from this module. Also, there is increase in positive attitude among children without disabilities. So my colleague will finish with funding and transferability.
Thank you. So since this was a project, currently we have got thank you. We have got no fund to scale up throughout Zanzibar. The Ministry of Education in Zanzibar has not started to replicate this training, even though we have mentioned that it was like a cascade model, and now we have done a whole school immersion. So we are here as the State University of Zanzibar seeking additional grant and international collaboration to expand the training to more public and private schools, aiming to reach at least 30 schools per year. Also, the way forward is we are looking forward to invest more in pre-service teacher education so that all teachers can get the message of inclusive education from day one when they start their teacher training. But also, we would like to support the Ministry of Education with in-service teacher training to teach inclusively through school-based training. Thank you very much.
I know we have a lot of information to share, and there's only a limited amount of time, but thank you very much for that. It was wonderful to hear from the front lines of the classroom. I'm sure there are teachers here in the audience who may have had some experiences looking at how to improve student outcomes. So this has been a wonderfully innovative way at doing that. Okay, now I will in fact turn to my colleagues from GIZ. Please, the floor is yours.
Thank you, Joshua. Thank you, everyone, for attending our session and for the co-panelists. I'm really excited to be here. It's really an honor to present. And I'd like to start off by explaining what we're actually doing, because it might be a bit confusing and different from the other presentations. So both Helle and I, we are advisors for the German Federal Ministry of Economic Cooperation and Development. That was already almost 9 minutes. So short, we call them BMZ. And we advise them in their strategic positioning on different sectors, and Helle on the inclusion of persons with disabilities, and she's the education focal point, and me and my team on education, and I'm the inclusion focal point. So we're basically counterparts. And that's why we're co-presenting, and accordingly we won't show one innovation, but rather give different spotlights of German development cooperation in that field. So I'd like to hand over to Helle.
Yeah, thank you, Hedi. Yeah, as I've already said, I'm Helle, and inclusion of persons with disabilities is a cross-cutting issue of German development cooperation and, of course, of our federal ministry. And that's the reason why we, in our project of global project on inclusion of persons with disabilities, that our advices and implementing activities include different topics. So we are not talking here only about education, but also we advise on health, the state and civil society. For example, we are working also together with DPOs and NGOs. We are advising concerning social security, the flight context, and as well economic promotion and basic education and vocational training and other topics as well. And when we look at the activities of the federal ministry, we are very proud now because we just the ministry adopted a cross-sector strategy concerning the inclusion of persons with disabilities. It's the first one. We launched it, we adopted it in December 2019, and it serves as a binding guideline for actors in German development cooperation. And it's very important to say that there's the aspect of to focus on a more systematic approach for the collection of data and for the monitoring of the strategy within the implementation planning. So there are two lines, the strategy, and the second, the implementation planning process.
Yeah, and similarly, we also have an education strategy that is obviously guided by SDG 4, quality education, and is understood as a human right for everyone, which means that accordingly inclusion is a cross-cutting topic also in our education strategy, and is understood as a holistic approach across all education levels. So in our education portfolio, currently we have around 123 GIZ projects and specific components that deal with education, TVET, technical vocational education and training, and youth. And this is just GIZ, because BMZ is also, the ministry is also commissioning other projects as well. And in this portfolio, we try to use a twin-track approach. So on the one hand, we try to, we include target group-specific activities, and on the other hand, we try to mainstream inclusion.
Yes, and when we are looking at the GIZ projects on inclusion in general, we have at the moment 103 GIZ projects and specific components that are dealing with the inclusion of persons with disabilities in different sectors. And when we have this number, 7 of them focus on education, basic education, and 13 on TVET, so vocational training. Yes, that's not so much until now. We have to have more. That's why we try to advise and support our colleagues in different sectors in the inclusion.
The background picture shows Ranim. She is one of our project beneficiaries of an inclusive education project in Jordan. And last year I actually visited the project team, and I also met her, and I'd like to quote her. She told us, "I'd like to say that anyone who is like me shouldn't be hopeless, because they are just like any other human, right? They can study and learn and benefit as well." And her mom, we also talked to her mom, she told us that, society recently, or many times, criticized her for still bringing her to school. They ask her, well, she can already read and write, so why does she still go to school? And she told us that for her, it's so important to bring her daughter to school because she has such a long journey ahead and her future lies in her education. So that was really inspiring. And this also brings me to our first innovation. And I'm really glad actually to announce that our colleagues from Jordan are here as well. Maybe they can wave quickly. Exactly. So this project, promoting quality and inclusive education, short PROMISE, is actually promising. And for us, it is innovative because it's the first project that actually focuses on inclusion in education as a main aim. And so the aim of the project is to support the Jordanian Ministry of Education in establishing or enhancing the foundations for an inclusive education system by different activities, by making contributions to capacity development on different levels, national, district, and school level, by awareness raising and ongoing needs assessment. And the implementation has recently started with the launch of the 10-year inclusive education strategy. And activities will focus on 6 schools and 3 field directorates in different regions in Jordan, North, Middle, and South Jordan. And the team is just in the process of selecting the pilots and in establishing a 3-year action plan. Just some quick takeaways. As I said, the project has just started implementing. But I think, especially yesterday, this point came up that it's so important to have the political commitment, and in Jordan we can actually see that it's a very welcoming context, and as I said, the inclusion strategy was just launched, so it is really a good momentum to push for such a project. Nevertheless, there are the well-known challenges that remain, which is the lack of capacities, the increased burden on the education system by Syrian refugees, and also the differing understandings of what inclusive education actually means. So one important takeaway is that there needs to be a really comprehensive understanding of what this term means. And in the way forward, the team told me that they will try to look at or try to include knowledge and experience exchange between the pilots and also to use existing structures. And I'm really excited to see this project developing.
Okay, we are running nearly out of time, but I will shortly present our innovative aspect that we are working in Ghana together with an IT service company called Amali Tech. And we are trying to include young talents with disabilities at their training and service center. And we have different sourcing channels to reach out to people with disabilities, and accessibility is a core principle in the selection process. So we are working together with DPOs, special schools and special needs units at universities, for example. And yes, and important takeaways are that including experts and consultants with impairments and role models with disabilities is very helpful in order to advise on different activities. And it's important to continue awareness raising, as we already do during the whole conference here. And if you want to know more about this, I'm very happy to talk about you and to give you the contact of my colleague who is the expert on the digital side of this project. Yes, and for more information, as I already began to say, you can find our email contact on the first slide of our presentation, which is disability@giz.de, and our personal contact addresses. And we are happy to share with you more information.
Just a last 30 seconds, a short sneak peek. On behalf of BMZ, we are going to publish a toolkit on education and digitalization in April, and one chapter is going to be dedicated to digital solutions and inclusion. So we just invite you to have a look at it. It will also include good practice from Malawi, where we had a blended learning course on inclusive education, an in-service course for teacher training and development on how to include children with disabilities in their classes. So be ready. Feel free to approach us with any further questions. And
and one last thing concerning the strategy of it, the strategy of inclusion of persons with disabilities. Unfortunately, I couldn't bring it because it isn't published in English until now. But if you have my contact address, I can send you the website and the German one, and I will inform you when the English one is published. So. Thank you very much.
Thank you very much for that. Appreciate it very much. All right, let us head now to our final presenter. The floor is yours.
Good afternoon, ladies and gentlemen, and thanks for listening to our session. I'm talking about a chance for children in Uganda now. Kinder eine Chance and A Chance for Children, its Ugandan partner NGO, were founded in 2008 in Innsbruck, Austria, as a small private initiative. The headquarters of A Chance for Children is located about 60 kilometers western of Kampala, the capital of Uganda, in a village called Sigoti. What characterizes A Chance for Children is that we have grown to one of the biggest exclusively honorary organizations in Austria, with a budget of approximately 2 million euros in the year 2019. We have 280 local full-time employees in Uganda. The main pillars of our work are education. Altogether, we have 17 own schools and kindergartens, if you count them together. We have many different workshops and farms for vocational training, and we have programs for children with disabilities and water supply programs for communities. We are running 5 inclusive centers for children with disability outside Kampala. This is already an innovation on its own, because almost all NGOs are only focusing on the capital. If you go to the villages outside of the capital, there is almost nothing. We are operating quite huge home therapy and social work programs from different locations. We organize outreach clinics, therapy camps, and we do a lot in including children with disabilities in our many other own schools and kindergartens. As mentioned, our centers for children with disabilities are intentionally not in Kampala or other big cities. We wanted to find and support the poorest children, the poorest families with children with disabilities, deep in the villages, and we built our schools in different, easily accessible areas. So we needed a method how to find these children. They are very often hidden because their family see them as a burden. And that's why we came up with this idea of having sub-county clinics where we organize an event to assess and register children with disability at the headquarters of the local government in cooperation with the local government. Therefore, we do a lot of advertisement, we talk to the local leaders, we make announcements in the radio, and our social workers and therapists visit the villages and the families. If mobilization is successful, we often get huge numbers of clients at those events. And then afterwards, to intensify the contact with these families, we invite them to one of our holiday camps. These camps we arrange at our buildings during holiday time. At these 2 weeks camps, our therapists provide a lot of intensive care to the children. They teach their parents different exercises and give courses about different topics related to disability and rehabilitation. And now, from these children, we know from our camps, we can pick those where we think they can benefit most from one of our facilities, and we offer them a space. There they get school teaching in different classes and, of course, again, a lot of therapy. And for many of these students, this is just one step to join another primary school later on. For example, on this picture at the right, you can see a little boy walking with crutches. His name is Jamba. When he joined us about 3 years ago, he wasn't able to walk, not even with crutches, and nobody thought that he would be able to catch up with other students in a school class. But he really developed a lot, and after 2 years of intensive therapy and rehabilitation, we were able to send him to one of our primary schools. Now you can see him walking on this picture in front, and it was really a special moment to me when I visited the school this summer and I saw how good inclusion works there. So this was just an example. Up to now we managed to include more than 30 children with different disabilities to our own primary schools. Of course, it was not easy at the beginning. We had to, first of all, adapt the buildings, employ assistive staff, but also create a lot of awareness in the school environment within the teachers, the headmasters and headmistresses, and last but not least, the students. But now it really works out well, and it's just normal to them. Now, I want to come to another innovation closely related to the environment and sustainability sector. Just very brief. What children with disability often need are splints or orthoses. And that's why we came up with a workshop for splints a few years ago. And now we are very proud that since more than a year, we are producing all our splints from recycled plastics. And there I want to show you a short video. I got one splint here, so if somebody's interested, just come to me later. As there are very many children with disabilities in Uganda, this map shows the homes of children in the catchment area of one of our facilities where we are operating. And this circle has a diameter of around 100 kilometers and it contains around 1,000 homes. And as we gained a lot of knowledge on how to develop programs for children with disabilities in Uganda, our future development plan is to expand our services to other areas to increase the number of children and families who benefit. Thanks a lot.
Thank you very much for your presentation. That's very inspiring to see how possible it is to really take advantage of the local situation, the resources that are available in your area when you have the right resources at work. Thank you to all of the presenters during our session today. I really learned a lot from all of your innovative practices. Can we give them one last round of applause, everyone? I think we may have time for just a couple of questions from the audience. Let's begin with two, and then we have a special request for an announcement from the interpreting team. After that, if we have time for more questions, we'll take them. If anyone has any questions, please wave your hand high if you can, or do whatever it is that you can do to make yourself known. Any questions from the audience at all? Yes, I see one way in the back. Do we have a microphone to give to that person, or is there?
Yeah. That's it.
Or can you use the microphones on the tables in the room?
Yeah, thank you. Actually, I have a question for Zimbabwe and Tanzania regarding the teaching learning methodology in the classrooms, because that will lead me to the other question, if you allow me. Teaching learning methodology in mainstream schools.
Okay, let me answer that from Zimbabwe. I agree that it is very difficult to be talking about teaching and learning and standardizing it in classes where there are children with and without disabilities. But what we have also tried to do is provision of assistive devices to ensure active participation by all children. But in addition to that, we have also supported the procurement of interactive boards, and I have seen that working very well.
Okay, that's it. But could you just help me also with some changes you had to make in terms of curriculum? Because in Zimbabwe, there is a change from special schools to reverse integration. That means the curriculum will have to meet the needs of children with no disabilities. Tanzania, it's from mainstream to inclusive. That means meeting the needs of children with disabilities in the classroom. So either ways, there would have to be changes in the curriculum or in the teaching learning methodology. Or it's an answer too long. Because we didn't notice that in the teacher training modules for Tanzania, that is missing. And I feel teaching, learning in the classroom is the most important indicator of successful inclusion. Thank you.
Okay, I will answer that again from Zimbabwe's perspective. The curriculum is the same. And what we have been lobbying for is also ensuring that some of these children are given more time in examinations, but also what is lacking is the capacity building and training for teachers. As I mentioned earlier, that we are still developing our inclusive education policy, and where you don't have a policy, it becomes very difficult to standardize and to really talk about some of these things. So we are hoping that the policy will shape the way forward, and of course, resources are definitely required.
Thank you very much for answering that very important question about curriculum. It is interesting to see and important to know that curriculum should be standard for both children with and without disabilities, but the supports will need to be individualized. Thank you to our presenter from Zimbabwe. Any other questions from the audience? Or would our colleagues from Tanzania like to respond?
Right. In Tanzania, yes, there has been a curriculum review, at least the curriculum for primary schools, but the main challenge is still in the assessment. The assessment system is still not very disability friendly, so there is a lot to be done in terms of assessment to make sure that all children are assessed accordingly.
Thank you for that. Yes, I see a question here.
In the same vein as assessments, I was wondering from the school's perspective, what actual screening program or screening methodology that you've been provided with or that you are using? Because we find, even in British schools, that screening is actually the hardest element of deciding who and where is educated, and particularly in an inclusive situation. And if you're in a low resource setting, how do those teachers find out that really quite difficult information?
The screening that we provide to our teachers is early identification of learning needs. But we also do medical screening in collaboration with the Ministry of Health. So we do both screening for learning needs and medical screening. For medical screening, we work together with the Ministry of Health.
Deborah, did you want to add to that, or no? Just wondering if anyone else on the panel has any comments related to that question. No. All right, I will. Screening and assessment is a hot issue. It is problematic at a lot of levels, but I think we don't want to move too far to a medical model of disability, and be sure that we are providing educational services that are still appropriate. So I do want to avoid that. I think that's an important topic of discussion, and we should continue to promote the rights of children with disabilities in the educational approaches that we give them. Are there any other questions that we have come up? If not, I want to turn it over to our interpreting team who wants to make an announcement. Okay, I'll let them quickly make an announcement, and then I do see a question here from my right in the audience.
Yeah, good afternoon. We are, you've been seeing us the whole time here interpreting. We're for hearing interpreters from Austria using Austrian Sign Language, and for deaf colleagues using International Sign. And I would like to ask you for a big applause for our colleague Kyle, who has really been helping us today at the panel, because it's not accessible for Joshua. He can't see the sign language interpreter over here, so we needed a big help from Kyle, who's jumping in and helping us. So I hope you like Austrian chocolate, and thank you very much for your help here.
Thank you very much. Thank you very much to the interpreting team for pointing out that it is, more work than what you just see, that there are some things going on behind the scenes. And it's important for us to all recognize that the barriers exist for those who are participating in the conversation, and that we have some wonderful supports to make that happen. So I recognize the final question here on my right-hand side.
Thank you so much. Great presentations. Mine is more of USAID and GIZ. One of the challenges that our colleagues from Tanzania have said is issue of resources, and they could not continue. And I was wondering if there's any specific focus or priorities in terms of providing support to finance inclusive education and people with disabilities in sub-Saharan Africa, including Tanzania and specifically Zanzibar. Thank you.
GIZ, do you want to speak to that first?
Well, so at the moment we don't have projects in Tanzania and Zimbabwe or Zanzibar, which one was it? Okay, yeah. So I can't really talk on that, and overall in our education portfolio it really depends on different factors and how far which project will be set up, because there of course is a competition between proposals and funding, and at the moment really we're working on a new, let's not call it education strategy, but a new concept that will set out some focus areas, and inclusion will be a cross-cutting theme. And we are just hoping that we can continue lobbying for this very important topic. And at the moment, I mean, for those of you who know the OECD or the DAC gender markers, so we're trying to find a way of including inclusion also in our project proposals to make it more realistic that funding will be also channeled into that target group activities. I don't know, do you have anything to add, Helle?
Yes, I could add that this was which Helle already said, is also a topic for us as the global project on inclusion of persons with disabilities, because we often, or nearly always, every day, we are often dealing with the aspect that all our colleagues and the other projects says that inclusion is something on top, which they think they have to do on top, and not. It's very very challenging to explain our colleagues and the ministry that that we have to involve the inclusion aspect at the beginning of starting a project. And yes, and we have to say that we are starting, or we begin working to having a marker on inclusion together with the OECD, which is not the commitment of the ministry in Germany is there, but it's not fulfilled until now that we have a marker on inclusion, because the problem is, I could say it here, the problem is that whenever we want to have a marker on inclusion, for this, another marker concerning, for example, the climate or the forest or something like this, have to go out of the system. So we cannot add we cannot add a marker on inclusion to the list, and that makes it very problematic. But because of the situation that we are connected each other, so Helle and I, in concerning the education sector and also different sectors. I'm also working in the city development, and we are connecting us with other colleagues. There are many of us at GIZ who are convinced of the inclusion theme. I hope we can go more forward, but yeah, we are somehow depending also on the ministry.
Sorry, just because I forgot to say, because you asked about sub-Saharan Africa in general, maybe I invite you to follow up on this conversation after the panel, because we have projects in Malawi and Mozambique where we try to include some inclusion aspects, so I can just continue.
Yeah, exactly.
Sorry.
Thank you very much. I know time is limited. Very briefly, I will say that USAID has an education policy at which the heart is equality and inclusion. So we want to very much focus on marginalized students, and we have programs that are being developed specifically for inclusion of learners with disabilities who are not in the list of programs that happen every day. So we do definitely have programs in sub-Saharan Africa, and Tanzania is one of the countries that has won some grant money from USAID. So to close out, again, I want to thank all of the panelists for their interventions and for everyone who's attended this session. Thank you very much, and enjoy the rest of your time here at the conference.